I've spent the last 10 years trying to figure out ways to prevent these infections. And at times it feels um, that the impact is not greatly recognized. I think if you were to ask any neonatologist, they would say, yes, every year or two, we have a child die of an invasive staph infection. They're not common enough that they are imminently in people's radar. So everyone knows they're there and they're happening, but they're not happening with a frequency that's high enough that it really is right in people's forefront. So by putting the data together and putting numbers around it, we're really trying to highlight target populations that are so at risk that it really hopefully will galvanize people to take further action. And then the question is what is the action? So, we do in 2020, a working group from the CDC put out a document about strategies for preventing Staph aureus infections in children. So there are not guidelines, but there are recommendations from the CDC about how to protect babies in the ICU from staph infections. Unfortunately, some of the interventions and prevention measures that are used in adults haven't been studied as carefully in kids. So some of them are slow to be adopted. But we know there are strategies that work, and we are testing new strategies, which hopefully will come out and be effective as well. For most primary care providers, this is not going to be a common topic. Staph aureus is incredibly common in children, and it usually causes mild infections, skin infections, eye infections. Sometimes it'll cause something more invasive like a bone infection, but it rarely in children outside of the hospital is life-threatening. Babies in the first few months of life are really a unique population that is especially high at risk, and why we focus so much on this population with regard to staph infections. So I think for pediatricians to be aware of this, pediatricians spend a lot of time providing anticipatory guidance for families. And when their babies are in the NICU, oftentimes they're looking to their pediatrician, who they may have a relationship with because of an older sibling, for advice and guidance. So pediatricians can remind parents that there are risks that to babies while they're in the NICU, and the family may do things to help protect the baby from those risks. For example, we have previously shown in a trial that parents are a reservoir for spreading staph to babies, just like moms can spread group B strep to babies. So I think if pediatricians engage with parents and say, when your patient or your child is in the intensive care unit, you have to think about what risk you may pose to them. There are lots of good things you do for them by being there and being part of their time there for bonding and breastfeeding and skin to skin and support, but there are risks. So there are other things we can recommend, like making sure they're washing their hands, not coming if they have a cold or fever, or wearing a mask to protect the baby. So there are things that pediatricians can help contribute to the safety of children who are in the neonatal intensive care unit by providing that anticipatory guidance for parents. So I do think they can play a role for sure.